Avian influenza, commonly called bird flu, is a viral infection that spreads in birds, cows, and other animals. Influenza A, also known as H5N1, can sometimes spread to people. In humans, H5 subtypes of influenza A are the most common cause. It can cause mild to severe respiratory symptoms and pink eye. People who work with poultry, waterfowl, and dairy cows are most at risk. Symptoms of bird flu include a pink eye, conjunctivitis, a fever, a fatigue, a muscle aches, a sore throat, a nausea and vomiting, a diarrhea, a stuffy or runny nose, a shortness of breath, dyspnea. A type of influenza A virus, often H5N1 in humans, causes bird flu. The virus can infect your upper respiratory tract and lungs, and sometimes spread to other parts of your body like your brain. Humans can get bird flu if they come in contact with an infected animal's body fluid, like spit, saliva, milk, respiratory droplets, or poop, feces. You can breathe it in from small dust particles in animal habitats, or get it into your eyes, nose, or mouth after touching body fluids. You don't get bird flu from eating properly cooked poultry or eggs, or from drinking pasteurized milk. Any flocks known to have avian flu virus are immediately taken out of the human food supply. Bird flu is very rarely contagious, spread from person to person, but there have been a few cases of spread between humans. In almost all cases so far, human bird flu infections have come from contact with infected animals. But anytime a human is infected, it's possible that the virus could mutate to spread easily to other humans. People who work with poultry, waterfowl, like ducks or geese, and dairy cows are at the highest risk for bird flu. Bird flu can often cause severe illness. Complications include a pneumonia, or acute respiratory distress, a bacterial infections, a sepsis, a brain swelling, like meningoencephalitis, a respiratory failure. Healthcare providers can diagnose avian flu with a throat or nose swab, or a swab from the conjunctiva of your eye. Current tests will detect highly pathogenic H5N1, bird flu, as influenza A. Labs don't routinely test all positive influenza A swabs for avian flu, so you have to let your provider know that you've been in contact with birds, cows, or other animals that could be infected. Then, if the test is positive for influenza A, the lab will send the sample to a special lab to be tested for bird flu. Ways to reduce your risk of bird flu include: wear protective clothing, like gloves, a mask, and goggles, when working with birds, wild animals, and livestock. Wash your hands frequently when handling birds, wild animals, and livestock, or after being in areas where they live. This includes visiting petting zoos, farms, or areas with water features that geese or ducks frequent. Don't work with animals who are sick or who've been exposed to avian influenza. In case of an outbreak, follow public health guidelines to limit the spread. Take your shoes off before entering your home if you've been in areas where birds like waterfowl or chickens live. This reduces the risk of spreading bird droppings or anything else that could be contaminated with the virus around your house. Don't touch or drink unpasteurized milk. Get a seasonal flu shot. This won't directly protect you from bird flu, but it can reduce your risk of serious illness and of getting both avian influenza and seasonal influenza at the same time. Co-infection. Islam generally recommend that people should avoid the pain and suffering that results from some contagious and fatal diseases. The proof for that is the words of the Prophet, blessings and peace of Allah be upon him. No sick camel should be put with healthy camels. The one who owns camels that are sick with mange and the like must not bring them to land or water to which the one who owns healthy camels brings his camels, lest the sickness be transmitted from the sick camels to the healthy camels, and thus spread further. Undoubtedly, everything happens by the will and decree of Allah. Allah, may He be glorified and exalted, criticized those who believed in bird omens when He said, interpretation of the meaning. But when good came to them, they said, this is ours by right. And if a bad condition struck them, they saw an evil omen in Moses and those with him. Al-Araf 7:131. In other words, they were saying, this is bad luck that was brought by Musa and those who were with him, and it has only befallen us because of their evil. But Allah criticized them by saying, unquestionably, their fortune is with Allah, but most of them do not know. Al-Araf 7:131. It was narrated that the Messenger of Allah, blessings and peace of Allah be upon him, said, flee from the leper as you would flee from a lion. We believe that diseases cannot become contagious by themselves because the Prophet, blessings and peace of Allah be upon him, said, there is no adwa, contagion, and no tayara, superstitious belief in bird omens. That is, these diseases are not contagious in and of themselves. Rather, Allah causes them to be transmissible, and He has created in them that which causes the disease to pass from one person to another. Thus, mixing became a cause of that, and people should avoid the causes by means of which the disease is transmitted, in compliance with the instructions and guidelines mentioned in the hadiths. The evidence clearly indicates that if sicknesses are transmitted as a result of mixing with those affected by them, that transmission only happens by Allah's leave. A person could mix with others without becoming infected by the protection of Allah, but it is generally mandated that quarantine should be made compulsory. Hence, in the case of this, bird flu, everyone is advised to take good care of their health and practice social distancing, while also quarantining the sick and trying all possible best to care for them. One should avoid any contact with infected areas and people, or infected materials, even suspected substances or possessions of suspected or infected people or person, while also praying for good health for oneself, loved ones, and the affected country.